Surgery is a delicate procedure, and great efforts are made in order to safeguard the patient from infection or surgical errors, and the hospital from liability. Now there's a new tool for orthopedic surgery from Edge Surgical.
Surgical site infections are a growing and costly hazard in any surgical environment. Some forms of infection have been traced to specific surgical tools whose design does not allow for adequate sterilization using any of the common methods. Certain orthopedic procedures require an implanted plate to stabilize broken bones. These plates are fixated using screws, and the holes drilled into the bone must be measured accurately so that the correct size screws are utilized. The tool traditionally used to measure those drilled holes, if not appropriately cleaned and sterilized, can introduce infection into the surgical site, including inside the bone. These types of infections have a significant adverse impact to the patient and are costly to address, yet often they are avoidable. Now, there is a single-use tool for that application, with a superior design that is more accurate and completely disposable, thanks to Chicago's Edge Surgical.
Our flagship product is the first single-use electronic depth gauge we call the EDG. And it's used to more accurately and safely place orthopedic surgical screws, and is used to improve surgical outcomes, enhance patient experience, and of course, reduce overall healthcare costs.
The electronic depth gauge, or EDG, features an easy-to-see digital readout, and the threat of contamination is eliminated because this tool is treated like any other single-use device. It emerges from a sterile packet and then is discarded.
The EDG, it's better because number one, it's more accurate. Number two, it's used only once on one patient solely, so there's no chance for debris, potential infectionitis getting transferred from patient to patient. I think that it's ultimately going to do what all surgeons want to do, which is to improve patient outcomes and enhance patient safety.
Finding a better way of accomplishing this procedure could result in savings in excess of $500 million per year to the U.S. healthcare system.
So what we are seeing is a large portion of the orthopedic industry moving towards affordable, single-use solutions that obviously offer clinical benefit, but also product differentiation.
Patient outcomes are too important to gamble with, especially when a fully sterile operating environment is such a simple solution. Suppliers like Edge Surgical are dedicated to providing cost-effective tools to help safeguard everyone's health and well-being.